That'll be next Saturday at Terry Sanford. You want to be there. Registration at 1 o'clock. You know, there was some great news that came down yesterday. Well, actually earlier in the week, but I found out about it yesterday. The FDA has approved the first drug for lupus in 52 years. You know, we've had our fall walk for lupus here in Fayetteville. And I'll tell you, it just makes you feel good to know that the money that was collected, went to a very worthwhile cause. And you can see some results here now. Christine John Fuller is the president and CEO of Lupus Foundation of America, the Piedmont chapter. Hey, Christine.
Hi.
How are you this morning?
I'm doing great.
Well, good. Can you tell us a little bit about this drug for lupus?
Yeah, the big important piece of this is to know that there has never ever been a drug specifically developed for lupus. So this is the first drug in 52 years that lupus patients can take, but it's the first one ever in existence. And
wow.
The phenomenal piece about this is we've had individuals with lupus that have had to be on really nasty treatments, corticosteroids, anti-malarials, just not really great drugs to be on.
Would you give us an idea what lupus is all about?
Yeah, absolutely. In its simplest forms, lupus is an autoimmune disease in which the immune system becomes hyperactive. So instead of attacking the foreign antibodies, it begins to attack the body itself. And it manifests itself in the way of inflammation within the body. So for one person, it's a skin rash. For another person, it's kidney involvement. For someone else, it could be cardiopulmonary. It can literally attack any organ of the body.
Mm-hmm. FDA approval takes kind of a long time to begin with.
It does, and obviously not many diseases out there are in the same place we are, which is that they've had to wait 5 decades to be able to get approval. But because of the complexity of clinical trials, the complexity of lupus, it's been very, very difficult. And so we have been obviously waiting for this. And we have individuals that have literally been living their entire life on the same medications that they were diagnosed with 3 decades ago.
When can treatment with this particular drug begin for those lupus patients? Immediately?
Well, they're hoping that within the next couple of months they will have it on market, and so I would say to anybody who has lupus, definitely check with your rheumatologist. Your physician is going to be the one that can determine if it is right for you. It's called Benlysta, and they can at least kind of assess it, see if it is right for you, and be able to try that out for you. But it'll probably be about 2 months before it's on market, but I would go, and the next appointment you have, go ahead and start asking about it.
Mm-hmm. We're speaking with Christine John Fuller, who's president and CEO of the Lupus Foundation of America, talking about a new FDA-approved drug. And I wanted to speak with somebody who is a lupus patient, so you got in touch with Stephanie Kennedy. Can you hear us, Stephanie?
I can. Hi, how are you?
Great. How are you doing?
I'm doing wonderful.
Yeah. Well, how long have you been diagnosed with lupus?
I was diagnosed 10 years ago in 2001, right after the birth of my second daughter.
Mm-hmm. Has the disease progressed? Is it a degenerative disease of any sort?
It is. When I was first diagnosed, it was mainly just an annoyance. I had some symptoms I couldn't explain as far as, joint pain, muscle pain, unexplained fevers, and that's pretty much where it stayed for the first few years. Flares hit me here and there, but I could function pretty well. As the years progressed, I got more organ involvement as far as lungs and kidneys. Flares started lasting a little bit longer. I've had one that lasted as long as 30 days where I was in bed. Mm-hmm. And it's gotten to the point to where I'm in bed more than I'm not.
Yeah.
So it's grown in the past 10 years and kind of been pretty debilitating at times.
So this is a disease that also impacted your family?
Absolutely. I have 3 children. I have 2 preteens and a very active 3-year-old little boy. And it's been hard, especially for my youngest child, because with my other 2 children, I could function pretty well and, be out with them at their softball games, be out with them on the weekends. And now, I work a full-time job, so that takes me all week to have that energy, and then by the end of the weekend, I'm just in bed, and I don't get that time with him. And the sad thing is he's used to it now. He knows that that's the way Mommy has to function.
What is your day typically like?
During the week, I get up at 5 a.m. because I have an hour commute to work.
Mm-hmm.
I work all day. I come home. I'm home by 6 or 7, and then I'm in bed.
Wow.
And I stay there till the next day. Same thing on the weekends. I use that time to recuperate from my week. So while everyone else is out enjoying their weekend on a nice Saturday like today, I'm in bed.
Well, let me ask you, Stephanie, how do you feel about this announcement of this new FDA-approved drug?
I am so excited. I had to tell you, the entire week prior to when the announcement was supposed to be made public, I was a basket of nerves. I had been looking forward to this for months and just praying that it happened. It's a change for those of us who have had no hope. Like Christine just said, you know, it's been 52 years, and so being on the anti-malarials, being on the chemotherapy, you just kind of realize that that's going to be your life. And so when that news came that Benlysta was coming around, it was like a renewed hope. You know, is there a foolproof plan that it's going to work for everyone? Absolutely not. But it's a step in the right direction, and it's a step in the right direction to more awareness, more research, and more treatment. So it's just the tip of the iceberg right now.
Christine, is this drug something that treats the symptom, or does it treat the illness itself? Do you know?
It does. It treats the illness itself, and it's the first one to be able to do that. So it actually targets disease progression, whereas most of the other treatments that folks are on are handling the symptoms, the inflammation in the body. And Stephanie is exactly right. So this is not going to work for everyone, but what we keep telling people is this allows us to begin to build an arsenal of safe and effective treatments for individuals with lupus. And now that we've had a successful clinical trial and the FDA approval, we've now opened the door wide for other companies to be able to come in behind and be able to continue to have some other safe and effective treatments on the market.
Okay, now, I just want to touch on one other thing, and that is we have something coming up in the fall right here in Fayetteville that people can get behind and help raise some money for lupus.
Yeah, and in fact, we've got some exciting stuff that's come out of the Walk for Lupus now that we do. So we do our walk every fall. It is September 17th this year, and last year we had about 600 people. We're probably expecting somewhere between 700 to 800 this year, and they can even check it out already. The information's on our website, which is lupuslinks.org. It's September 17th, but because of that, we've begun to start doing things here within Fayetteville. We now have regular educational programs. We now have a support group that meets the second Tuesday of every month here in Fayetteville for individuals that are living with lupus, and all that info can be found on our website at lupuslinks.org, and that's LUPUSLINKS.org.
Well, Christine John Fuller, President, CEO of Lupus Foundation of America, Piedmont Chapter, we thank you. And Stephanie, we thank you, and we'll be praying for you as well.
Thanks
so much.
I appreciate it.